Hi, you are in the ladies' room with Dr. Donica, the only public ladies' room you can enter anytime without ever waiting online. I'm your host, Dr. Donica Moore. We'll be having real conversations with real women about really intimate issues. They may be embarrassing, sad, or funny, but they will always be interesting and informative. You know, like the best conversations you've had in ladies' rooms with your best friends, or total strangers and a physician. Please join us. Hello and welcome to another exciting episode of In the Ladies Room with Dr. Donica. Today we have a topic that I know half the people listening are going to be very excited about, and a few people are going to dread because they resemble this topic. With warmer weather approaching, it's not just a time to change out our wardrobe. Most of us are changing out of sweaters for sleeveless tops, but it's also a time to re-examine your skincare routine. Heat and humidity can wreak havoc on your skin, particularly if you're one of the 16 million Americans with rosacea, a chronic inflammatory skin condition that's plagued by facial redness, acne-like breakouts, and sensitive skin with burning or itching. Now, despite the fact that rosacea is fairly common, most Americans don't even know what it is, or if their skin symptoms could be a sign of this problem. So let me tell you a little bit about it. In general, but not always, rosacea tends to first appear after age 30. People who are afflicted may just have one symptom or a combination of symptoms that happen regularly or occasionally. The symptoms, as I already mentioned, include facial redness, also blushing, acne-like breakouts, visible blood vessels, and sensitive skin with burning, itching, or stinging. Many times, people report rosacea flare-ups. These can be triggered by sun exposure, hot or cold weather, spicy foods, alcohol, and emotional stress. Left untreated, rosacea can worsen, and it can cause thickened skin and even irritation of the eyes. Abundant research finds that people with rosacea feel sad, embarrassed, or depressed about the appearance of their skin, and may sometimes even avoid social situations as a result. So we're going to talk to Dr. Ava Shamban today, who is a real expert in this topic. She's a leading board-certified dermatologist, and together we're going to not only discuss the topic, but debunk some common skincare myths, provide some very need-to-know tips to maintain clear skin in warmer weather, and provide further information about the symptoms, triggers, and treatments for rosacea. She understands the close link between appearance and self-esteem and dedicates herself to helping patients of all ages improve their skin to live happier lives. And she loves to say, I love this quote, life happens, but it doesn't have to show on your skin. Although many people my age say it shows in our wrinkles. Now, many of you may have seen Dr. Shamban on one of her many television appearances, whether it's on the CBS show The Doctors, the Steve Harvey Show, Extra, or as the skincare maven on ABC's Extreme Makeover. A California native, Dr. Shamban graduated magna cum laude from Harvard University and earned her medical degree from Case Western Reserve University School of Medicine. She completed an internal medicine internship at Mount Sinai Medical Center in New York and went into practice as a general practitioner in California for 2 years. She then took a little detour and did a Dermatology Foundation Research Fellowship and then completed a residency in dermatology at Harbor UCLA Medical Center. She currently serves on the editorial board of the Journal of Clinical and Aesthetic Dermatology, in addition to heading her dermatology practices, yes, that's plural, in Santa Monica and Beverly Hills. And in addition, she recently launched her new skincare concept space called Skin X5 in Pacific Palisades, and we want to hear a lot more about that. We also want to hear about a rumor that she is launching her own new podcast, and she's calling it Dr. Ava Says, after another program which she hosted as the part of the Condé Nast Entertainment digital series. She's also the author of Heal Your Skin, the Breakthrough Plan for Renewal, which we hope to have as a future Book of the Week selection on our weekly Facebook Live program, Ask Dr. Donica Your Most Embarrassing Questions. So with all of that, please help me welcome Dr. Shamban. You are in the ladies' room. Thank you for joining us.
Well, I really like the idea of being in the ladies' room. It sounds very private and personal and kind of, I guess, sort of cozy, as long as the lighting's not too harsh.
Well, it depends on the ladies' room. Some ladies' rooms have industrial light and I have softer lighting. But the ladies' room is where we let our hair down. It's where we share our tips with other women. It's where we talk about things that we wouldn't necessarily talk about in mixed company. And sometimes it's easier to talk about things which are embarrassing or disturbing or upsetting with total strangers as opposed to your best friends. Although certainly most of us have had great conversations in the ladies' room with our best friends. And we have many men listeners, and these are all men who have been saying for decades, "What do you talk about in there for so long?"
Well, we're standing outside waiting for
While
you to
we're
come out.
waiting for you. Now, they
Yeah.
don't realize that we're often usually waiting online. But
Yes.
with that, what's the most interesting, unique, memorable, or otherwise experience that you've had in the ladies' room, just
Well,
aside from this
I
conversation?
think I'm gonna come back to that. I think I'm gonna start with talking about rosacea because I think that certainly in the ladies' room, it is really common to have people talk about their skin. I mean,
Mhm,
you'll find women like putting on makeup, covering up pimples, covering up redness, covering, I mean, it's a very common place for people to really start paying some attention to their skin.
mhm,
And so rosacea is one of the most common underdiagnosed skin conditions that I experience. People will come in and they don't really know why they're red or they're flushing. They may blame it on some kind of a cream or a acne treatment that they are using, and they don't really see the connection between an actual skin condition. And so just for everybody to know, rosacea is a condition, and we tend to think of it having four different forms. So that it can just be a general redness with a little bit of blood vessels. It can look also like acne, but more of like a angry acne, with the papules being placed on a bright red background, and those little red bumps don't go away so easily. That's sort of the second form. A third form would be around the eyes, and a lot of time I see this very frequently, that people haven't found out why their eyes are watering or burning, and they've got these little red bumps around them. And then the last type is where you get what we call the rhinophyma, which is sort of a big bulbous nose.
right.
And so people really feel like, well, maybe it's something that I'm doing. And there is a certain truth to that, because rosacea is exacerbated or worsened by exposure to anything that makes you flush.
Mhm.
So whether it's heat, a spicy drink, a hot drink, anything that makes you flush. And that is really common. And as we
So
know,
what's the association? Is menopause a trigger and hot flashes?
so they can be not really a trigger. It turns out that people who have rosacea have a certain composition, a certain chemical, or the enzymes in the skin are a little bit different from people who don't have rosacea.
Mhm,
And so, like all conditions, there's a spectrum of mild rosacea to more severe rosacea. But
mhm,
yes, any kind of hormonal change can trigger rosacea,
mhm.
such as pregnancy, going on and off a birth control pill, and menopause, hot flashes. Yes, all of the above.
Now, one of the things I hear from a lot of patients with rosacea, in terms of the embarrassment factor, is that people often associate that sort of classic appearance, especially once you get to the bulbous nose, with being an alcoholic or drinking
Yes,
too much. So,
that's
talk about the association with alcohol and what part of that is true and what part of that is hyperbole or not true.
so. Alcohol can certainly cause flushing. And so in people who have more like very superficial, we call them broken capillaries, but in fact, they're just extra capillaries.
Mhm.
So people who have these extra capillaries, they will dilate, they will open up more. And so the person who might be just a social drinker, not an alcoholic, they'll have one drink and they'll just turn red, especially with wine. And
Mhm.
so, yeah, so it becomes an association that people make between, alcoholism and a red face. But people who have rosacea and are alcoholic, well, that's a problem, because
Then you're
you
really in
really
trouble.
gotta look like an alcoholic. But yeah, but I mean, you're gonna flush anyway with a glass of wine,
Mhm.
and you really don't. I mean, but it's not a reason not to drink. I mean, I always tell my patients, you have to have a life, no matter what the issue is.
Mhm.
But going back to what you say about people making these impressions based on, what you look like. I mean, that is something that we are hardwired to do.
Mhm.
And which is so, and what that means is that we don't even think about these impressions, and this really comes out of our of necessity. If we walk into a room, we want to be able to assess whether people are going to hurt us, or people are going to feed us, or they're going to be our friend, they're going to be our enemy. And so a lot of facial expression and a lot of the actual appearance of the skin feeds into that.
Yeah, I recently read a study that said that we tend to make our first impressions of somebody based on the first 7 seconds of our encounter. And of course, most of these impressions are subconscious. They're not, they're not.
Yeah, they're definitely below the thinking part of the brain. They're definitely subcortical. They're in the old part of the brain. And that's how we were designed, really, to assess danger. And so, yeah, I would say that it happens even under 7 seconds. But because of this, and I think people instinctively know this, that they did a recent study, just looking at the statistic, that was published in the British Medical Journal, showing that slightly over half of people with severe rosacea, so these are people who are really red, really broken out, they actually said that they would trade a whole year of their life for a cure for rosacea. But, I think that's just, and so people are like, oh, well, appearance, it doesn't really matter. And, the issue is, yes, your interview. It
does matter.
It does matter, but how you appear and how you feel about how you appear matters in every aspect of our lives.
Now, was that one of the things that motivated you to become a dermatologist?
Oh, absolutely. I don't think I didn't recognize the connection between that until I started working. Well, until I just started, because I was a GP for a couple of years. And when I was a GP, I'd be fixing people's blood sugar and their hypertension, and, things you couldn't see. And they were sort of like, okay, that's really nice, and thanks. And really, I can't have any salt, and you're taking away all my desserts. And then for this, for dermatology, I cleared someone's acne, I took care of a mole or whatever, and they were writing thank you notes and sending flowers. And so I started to get an inkling for it. But then when I did Extreme Makeover, when I did all the dermatology for that show, I realized how important people's quality of their skin was to their quality of life, both how they had their self-esteem and everything else. So I
once got contacted by one of the producers of Extreme Makeover, and they asked me if I wanted to be on the show. And the way the question was phrased, my immediate response was, are you asking me as a doctor or as a participant? So it didn't work out because of the logistics, but at first I was really confused.
That's so funny. They don't tend to call for a cast member. They didn't tend to do that.
I actually was once on a cruise where I was watching people go up to the buffet table. And I said, God, I would love to be casting right now. I'd love to be the casting director for The Biggest Loser Cruise Edition. I thought that would be, a great thing to kind of go up to people and offer them this opportunity on a cruise. So we talked about in the intro about debunking some of the myths, and we've already talked about the myth about alcohol. Talk about the myth of association with rosacea in particular, but also with other skin problems and the sun, because certainly a lot of people think that if they go into the sun, their condition will be better. And that's true with some skin conditions, but not necessarily rosacea.
Well, in general, as dermatologists, we do not recommend sun exposure because the sun is the number one cause of premature aging. It is literally radiation. We call it ultraviolet radiation, but if you just take away the ultraviolet, it is radiation. It has been shown to damage the DNA of our cells. Of course, it's part of making vitamin D, but we like to supplement people orally with vitamin D as opposed to having them lay out and bake, because we know that that's the biggest risk for skin cancer of all kinds, from melanoma to basal cell skin cancer to squamous cell, you name it. And
wrinkles.
Yes. And of course, wrinkles, premature aging. You can just see if you look at your bottom versus the back of your arms, or rather your forearms. Just saying, that is something people might want to do in the ladies' room. But,
well, speaking of the ladies' room, interestingly, you mentioned that with forearms. Many years ago, I was in Australia. And, in Australia, they drive on the opposite side of the road.
Of course.
And they had this fabulous ad campaign that was posters that were inside the doors of the stalls in the ladies' room. So like you had to read it because you were there, and it was called the Slip, Slap, Slop campaign. So slip on a shirt, slap on a hat, slop on your sunscreen. But they were talking about data that they had that in Australia, the incidence of skin cancer on the forearm of the arm that is outside the window of the car when you're driving is about 4 times higher than the incidence of skin cancer on the other arm. So that really motivated me and influenced me.
Yeah, there you go.
Prior to that, I was quite a sun worshiper.
Yeah, and their campaign, by the way, that slip, slop, slap, or slap, slip, slop.
Slip, slap, slop.
Yeah, reduced. They had the highest rate of melanoma in Australia and South Africa of anywhere in the world, of deaths for melanoma too. And so that campaign reduced that incidence of death by like 70%. I mean, it was incredibly successful.
Well, it influenced me, and I was just a tourist.
Yeah, yeah. Well, it's pretty. But to your question about whether ultraviolet exacerbates or makes worse the rosacea, absolutely, because you're going to get 2 effects. One is you get more of the vessels just sort of opening up as a result to give off heat, because that's one of the ways that we avoid overheating. And secondly, the ultraviolet does help stimulate the whole system and part of the disease by just the exposure. So it is absolutely not, it is completely not going to help. So because some people think, oh, well, the ultraviolet is going to help my acne. Well, this is not, even though it's called acne rosacea, there are a lot of terms in dermatology where we use a word like acne just because of the appearance. It has nothing to do with the actual condition. And now that we know much more about the biology underlying a lot of these conditions, we tend to use more specific terms. So these like acne rosacea, acne vulgaris, there's just more description. Anyway, the good news about rosacea, rather than thinking that you want to have ultraviolet treated, is there are some very effective topical and oral medications for rosacea now. There's a prescription called Soolantra, as in soothing the skin, soothing the heat of rosacea. And it's an anti-inflammatory cream. And it really is effective in treating bumps and redness. And you start to see the result at about 2 weeks, but improvement, and I was an investigator for one of the trials for this cream, the improvement continues for as long as about 4 months, 5 months. It's very easy to use. And that's a great cream to ask your doctor for. There's an oral medication called Oracea, which is a low dose. The antibiotic is a doxycycline. However, it doesn't act like an antibiotic. It's not like it kills bacteria. It's more, I like to think of it as Advil for the skin because it's very anti-inflammatory. And so also the data for Oracea show that if you have to use it for about 16 weeks. That's how long you will continue to get improvement. But it seems to really change the course of the condition. So I'm just going to read off the...
So if somebody is on that drug, though, do they have to stay out of the sun? If you were taking oral doxycycline for a long time, that's what we would tell people.
Well, I think you and I have established that we don't want anybody to go in the sun. But yes, if you're taking an oral
medication, that takes it to a new level if you're on doxycycline.
Then you really don't want to go in the sun. Now, I live in Southern California. I mean, that doesn't mean that you can't have a life. So, because we live outdoors all the time, but that's the slip, slop, slap. So that your slop, slip, the 3 S's. So you're putting a hat on, you're really practicing good sun protection, which everybody, I see a lot more of that, sun protective clothing too. So the third one, the Soolantra, the Oracea, and the third medication is Mirvaso. And so this is a gel, and what this does is it just shrinks down the blood vessels. So it's a temporary relief of the redness. It's not a long-term solution. Now I'm going to say this a couple times because there is a website called rosacearelief.com, where people can go, all of your audience can go to learn more about rosacea and to learn about these medications, rosacearelief.com.
But of course, one of the things I always tell people, and my listeners are probably sick of this by now, is I always say the most important place for you to go for personal medical information about your own personal condition is to your own personal physician. So extremely important. Because I also, I love talking about obviously diseases, disorders, and conditions. But one of the things I always worry about, and I hear this occasionally from patients, is they don't come in because they didn't figure out yet what they have. And I don't want anyone to listen to us talking about what the symptoms are and think they have to make their own diagnosis and go to their own doctor and say, this is what I have, and here's what I want to be treated with. So, you just really have to know that something is not right and that you have symptoms. And I think the advantage of us giving background information as opposed to treatment information is that we're telling people that there are treatment options, regardless of what you have, whether or not you actually have rosacea.
Exactly. Here it is. I have a great mug. That says, please do not confuse your research with my MD degree. So
I need that.
So
Absolutely.
it's true. I mean, I do think though it's helpful for people to, especially after they've seen the doctor, that they research what their condition is, because we don't always have like an hour to spend with the patient, but it just helps in continue the conversation too. But but that being said, sometimes you go on, you Google something and then you see these horrific pictures and misinformation.
Because they're always the extreme cases. And what I need to put on a mug is one of the things I often say on television interviews is, just because I'm in your living room does not mean you're in my examining room. So just because you're seeing me does not mean I am seeing you. And in the days before cell phones, every one of my friends and relatives would call me on the phone about their derm problems. And first of all, I am not a dermatologist and I am not trained in dermatology, but I would always say, okay, put your arm up to the phone or put the rash up to the phone and let me see it. Now, of course, now you can do that, but back in the day, you could not do that. So one question I want to get back to about this issue with sun, and no, I'm not still lobbying for a better answer about justifying my going out in the sun. But what about people with eczema? A lot of people with eczema say that their symptoms resolve if they go out in the sun.
So eczema, that's actually not true. It's more that the eczema can get better with humidity. So if you go to a more humid environment, sometimes Florida, Hawaii, then your eczema will get better. But if you're going to like the sun in the desert in like Palm Springs or something, forget about it. That's not going to help. The only condition that people use light therapy really for is psoriasis. And so, but when I was first went into practice, we had light boxes where people would go in and they'd be in the light box. But I have to tell you that 10 years later, these people were just covered with skin cancers. So now there's other treatments that are safer to use for psoriasis. So we really don't use light therapy for anything. I mean, the most important thing about exposure to the light actually is improving your mood state and also establishing your circadian rhythm. But you can do that with some bright lights. But I should go back to the ultraviolet exposure for a minute too, because people think that if they're in a room and then there's glass in front of you, that the ultraviolet doesn't penetrate, but that's not true. Ultraviolet does penetrate through most glass, ultraviolet A, and this can be a problem for your rosacea as well.
And it can penetrate through clouds. So that's being another myth about sunscreen, that you only need to use sunscreen when the sun is out.
Yeah, that is completely a myth. And if you have rosacea, not only do you want it, and if it's real, and you want to get treatment for it, because another thing about rosacea is, I'm sure you've seen older people who have this sort of lumpy, bumpy, reddish skin. And so the condition will lead, this chronic inflammation associated with a condition will lead to a change in the actual texture of the skin, not just the ruddiness or redness of it. And so it is so important to treat that, so that as you go through the road of life, that you're, because that's my job, is I know what the future brings. You come in with a condition.
My crystal ball. I have coffee mugs and crystal balls.
No, it's called life experience. You got to get it treated. Otherwise, your skin is just not going to look pretty as you get older.
Now, for those people who did not get it treated and they come to you, are there laser therapies or skin resurfacing therapies or dermabrasion? Does that help for those people?
100%. So we often combine the topicals with laser treatments, intense pulse light to treat the redness, and the vessels, vascular lasers such as the V-beam. And so we might do a series of those treatments, but there is no treatment that is a cure. It is a condition that needs to be controlled. And so the more that you address it from a holistic standpoint, from, you know, the food that you eat, from the good skincare that you have, and the prescriptions, you know, the cilantro, the Rosacea, is how you're going to end up with beautiful skin. But I really feel like people, it's one of the most underdiagnosed, most common conditions that I
Well,
see.
why do you think it's so commonly underdiagnosed?
I think because people feel like they just look at them and they say, or they look at themselves, they say, oh, well, it's just, I have red skin,
Mhm.
or I keep breaking out, it's acne. And nothing I use is going to help for acne.
So you
But
think they're just using over-the-counter acne
yeah,
medication?
yes, which will be aggravating, which will be
Right.
because it's irritating. So it will aggravate the rosacea.
Now, you talked about this topical doxycycline, which you referred to as Advil for the skin. And of course, Advil is a non-steroidal anti-inflammatory drug. The generic is ibuprofen. Have
Right.
there been studies that have looked at systemic ibuprofen? Does that help decrease the inflammation?
Not really. No, and when I say that, it's just kind of what I tell my patients because it's not a topical, it's the oral, the
Oh,
Oracea,
got it. Okay.
which is a low dose delayed slow release doxycycline. Because people get confused. They think, okay, well, I don't want to take a long-term antibiotic. But actually at the dose level at which the Oracea where it is, it's so low that it doesn't kill the bacteria in your body at all. And so now that we're on, you know, on
The
top of
microbiome.
the microbiome, it's all about your microbiome.
Mhm.
It's all about your
We
microbiome.
talk a lot about the microbiome in the ladies' room. All right. So, anything else you want to say about rosacea? I think you really covered it very comprehensively in a very quick amount of time.
Yeah, just, you know, if you think, just don't hesitate. Come on in and see a dermatologist, and get diagnosed, get treated, go on to the website rosacearelief.com, and just know that you don't have to live with it, that you don't have to feel like you want to lose a year of your life, that there is effective and safe treatment for you.
I think that's excellent. Now, tell us about your podcast. Has it launched yet, or you're still planning?
Yeah, no, so I'm just getting started on it. And so I just really feel, I mean, I love radio.
Mhm.
and and so I just really feel that there's a lot to talk about in dermatology, you
Mhm.
know, ranging from like some of the topics that we've covered today, all the way to the emotional aspects. And, you know, what does it mean to be a woman? And what does it mean to be, you know, aging, or whatever we're going to call that word, you know? What is it, you know, how do you go about looking your best? And because there's so much information that I have, I mean, I lecture nationally and internationally, and there's so many new techniques and technology to address the face so that you can look your best version of yourself, not like someone who's just exiting the
Mhm.
witness protection program for your whole life.
We know some of those people.
Yeah, we know some of those people. So
So anyway, so I have a weekly Facebook video show as well as this podcast, and it's called Ask Dr. Donica, Your Most Embarrassing Questions. And we get a lot of germ questions. So I thought, since you were on our podcast, I would just turf them to you for this.
sure.
And these are going to be really easy questions for you.
Okay.
But I decided to pass on answering those, and I took all the menstrual questions and cramp questions and hormonal questions instead. So
Hmm.
the first one is, I'm an actress and I have to wear tons of stage makeup. I remove it as soon as I can and cleanse thoroughly, but I'm getting breakouts as a result. Some of the guys in my cast use charcoal masks. What are these and will they help? What else do you recommend?
So charcoal masks is a clarifying product. So charcoal is not to be ingested, but
Mhm.
it is a brightening and anti-inflammatory, and it is a clarifying product. Um, it is difficult, you know, because a lot of that heavy stage makeup does create acne. So getting the makeup off as much as possible, using something to exfoliate the skin gently, such as a salicylic acid or a retinoid, those will both help. There is a medication called Epiduo Forte, which is an acne medicine. You can apply it, she could apply a tiny amount of that. That's prescription. But in
Mhm.
general, removing the makeup completely, exfoliating, and then moisturizing.
Okay. And then with these masks, how often is that used?
Oh, the mask? Oh, once a week. A mask is
Okay.
usually once a week. Yeah.
Okay. All right. Next question is a good one. I just had my third child 10 months ago and I developed awful stretch marks. Help!
Mm.
3 exclamation points. Is there anything I can do? Why didn't this happen after the first 2?
Oh, yeah. Yeah, what's with that third child? You get more vessel, you get more veins in your legs, and you can get stretch marks. Probably the third one was bigger.
Mhm.
So if they're still red, you can actually have a series of laser treatments with one of the vascular lasers, and that will help because the target for that laser is the red. So it will heat up the skin and stimulate new collagen to be formed to help with the stretch mark. Using a topical, something in the retinoid family is also useful, and you do that every day and put a bunch of moisturizer on top of it. But they do tend to turn silvery and go away over time. But using a laser or topicals can help.
Yeah. And from an OBGYN perspective, one of the reasons it might have happened after the third one is maybe you didn't get rid of some of the baby weight after the first one or the second one, or maybe gained more weight during this
Right.
pregnancy.
Well, and as a gynecologist, like you're really only eating for a peanut extra.
Yeah.
For a peanut. You're not supposed to be eating like you're carrying around a truck driver.
Yeah, I did that. Or I like to say I still haven't lost my baby weight and my baby is 23 years old. All right, the next one. I'm 50 and I have sunspots on my face due to years of going to the beach without sunscreen. I think they appeared after I stopped taking birth control. I've tried topical cream, but it only faded them. How can I get rid of them?
So those isolated spots, which we call lentigo or freckles, they don't go away as easily with cream because they tend to be a little bit deeper in the skin. So talking to someone about having an intense pulse light treatment or one of the lasers for brown spots can be very useful. Using a topical, something in the retinoid family, is also helpful.
That's all we have time for today. But let's keep the conversation going on Twitter or Facebook at Dr. Donica. And please join us next week for another episode of In the Ladies' Room with Dr. Donica. Real conversations with real women about really intimate topics.